I very much appreciate having all of you join us here today on a Friday. Like me, perhaps you're a little tired. It's been a long week, been a long summer, right? I know you've been working really hard. Uh, Me and all my colleagues here on the call today really appreciate everything you've been doing. Many thousands of our university staff, academic staff, faculty, and student employees have been on campus working around the clock ever since this whole thing started in March to keep vital elements of our mission going, whether that was keeping students in the dorms that didn't have another place to go, getting meals served, keeping important research going, keeping our health enterprise going. Madison is a huge and varied place, and it's the people that make it go. Thanks for all you're doing for us on all of that. Of course, we're trying to stay plugged into that and what's going on, learn what's working, learn what's not working, and what we can do better as we go through this challenging time. One piece of our efforts there was a all employee survey. We just got the results from that survey back earlier this week. So more than 7,000 responses to the survey. One of the key things we were trying to figure out is, do people know where to get help and where to get answers to their questions? 87% said that yes, they had reviewed the Smart Restart website that we mentioned tirelessly over and over again. And I was happy to see 81% said the resources were helpful. So that means we haven't hit all the boxes yet. There's still some gaps. Some of the key themes we heard on that survey were a need for clear public health protocols. I'm going to talk about that a teeny bit. Jake will talk about it more. Ensuring our coworkers actually follow those protocols. Providing flexibility to employees who need it, either because of health reasons or other concerns like childcare and the like during the pandemic. And providing clear communications from leaders. So obviously we're here today trying to do that. Let me hit that health protocols point really quick. Our success this fall, our health as a community, the success of our mission really relies on us all doing our part and following these health and safety protocols. That means you're wearing a mask when you're on campus, when you're in a building, unless you're in your office with the door closed. Otherwise, you've got your mask on. You can't forget it. We will have masks. There will be disposable masks available. Indeed, we've made PPE freely available to all campus units. There's a form on the website where you can get PPE, face shields, gloves, masks, whatever you think would help you. And those are provided free of charge. It's also worth noting, to that point, we need to ensure our coworkers are actually following the protocols. You need to follow the protocols for yourself, but you need to follow the protocols for your coworkers. You have a duty and a responsibility to the broader community. And we do as an employer. So we're going to hold people accountable for doing this. If people are not following the protocols, discipline will be enforced using all the tools we have at our disposal. We know there are exceptional circumstances. Some people have health reasons they can't wear a mask. That's a different story. And of course, we'll be accommodating there. But we take this very seriously on the staff side as well as on the student side. One other quick point here before I hand it off. About flexibility. We have been going out of our way to do everything we can to be flexible for our employees in this time, because we know you need it and we need you. So we're doing everything we can there. It really has to be a kind of individual approach, generally speaking, to that. So talk to your supervisor, see what you can work out, see how we can get you what you need while still getting the work done. If you're not comfortable doing that, you can always talk to human resources in your area, or you could talk to the divisional disability representatives if even that feels a little uncomfortable to you. These are folks who are specially trained to handle confidential matters, and they work with us on like our ADA accommodations process, for example. And these folks are experts at negotiating and figuring out a way to get everyone's needs met. You can find a list of who your divisional disability representative is, or DDR is, on the Smart Restart website, or just by Googling it, UW-Madison DDR.